Hi, I'm Dawn Scrow, and I'm the Director of the EMS and Fire Science programs here at Lorain County Community College. I'd like to give you some information about emergency medical services and our programs. There are 4 levels of certifications in EMS. The first level is the Emergency Medical Responder, or EMR. Those certified as an EMR might work in a large business or factory where they are part of an emergency response team that would respond if one of their employees were to suffer from a medical emergency or were injured. They provide first aid until the ambulance with EMTs and paramedics arrive. You may also find EMRs working in a fire department that does not transport patients. And again, they would provide that first aid care until the transporting agency were to arrive. The next level is the Emergency Medical Technician, or EMT. This is the lowest level that can transport patients in an ambulance. EMTs provide basic life support as they manage medical and trauma emergencies. They perform CPR, manage a patient's airway to help them to breathe, splint broken bones, and dislocated joints. They are also able to administer several medications. The next level is the Advanced EMT, or AEMT. The advanced can do everything that an EMT can do, and they can also start IVs to give fluids and administer additional medications. The final and highest level is the paramedic. Paramedics can do everything that advanced and EMTs can do. In addition, they provide a higher level of cardiac care for those suffering from cardiac emergencies, administer many more medications, and have additional airway management techniques, including intubations and crikes. In order for them to do all of these additional procedures, they have to have a greater understanding of the pathophysiology of disease processes and traumatic injuries. Here at LCCC, we offer the EMR program through our non-credit course offerings. We also offer the EMT and the paramedic programs through our credit programs. Where can those certified in EMS work? Well, we traditionally think of EMTs and paramedics as working for EMS agencies on an ambulance. They can also become dual certified as firefighters and work for fire departments. They can obtain critical care credentials and work for critical care transport, either on a helicopter or flight or through ground transportation. We also find a lot of paramedics working in the hospital setting, often in the emergency room, in the intensive care units, and on the cardiac care units. EMS personnel also work in other areas of healthcare, including for the health department, for vaccine clinics, hyperbaric chambers, and providing medical care in prisons and jails. Really, the list of possibilities goes on, as there are more and more places where EMS personnel are being utilized. The job outlook for EMTs and paramedics is very good, with growth expected in the profession. There is a shortage of paramedics across the nation, so it's a great time to get into EMS. As you can see here, an EMT can start off making around $35,000 a year. This is a good starting point, especially considering that you can obtain your EMT certification in just 1 semester. Wages increase depending on where you work and when you work, as most companies compensate with shift differentials. There are also regular wage increases with longevity and promotions. In addition, most places of employment offer good benefits that include retirement packages. Similar to what we see with firefighters, as shown here, paramedics usually start off with an annual income in the mid-50s. They also receive increases for shift differentials, longevity, and promotion, and also have benefit packages with retirement included. How do you become certified? Well, we offer our EMT program 5 times a year. In the fall and spring semesters, which are 16-week semesters, we offer both a day-based and an evening-based program. The day-based program meets on Mondays and Wednesdays from 9 a.m. to 3:30 p.m. Our evening-based program meets on Mondays and Wednesdays from 5 to 11 p.m. We also offer the program during our shortened summer semester. In the summer, we only offer a day-based program since the class time is longer due to the semester being condensed to 11 weeks instead of the 16. We offer 2 paramedic programs every year. One is what we consider our part-time or traditional program. It runs at the same pace that most programs in this area run, which is just over a year. This program begins in late September and graduates in December of the following year. For the traditional paced programs, lectures and labs are on Thursdays from 9 to 5:30, and clinicals are typically held on Mondays from 9 to 3:30 p.m. We also offer an accelerated or full-time program. This is for people who are able to attend as a full-time student. It begins in late August and graduates in mid-May of the following year. For the accelerated program, we have lectures and labs on Tuesdays and Fridays from 9 to 5:30, and then our clinicals are still usually on Mondays, but the days are a little longer, from 7 a.m. to 5:30 p.m. With both of these programs, there are specialty clinicals such as trauma rotations and labor and delivery, and pre-hospital clinicals, commonly referred to as ride time, that are scheduled outside of those class times. The contents in both programs are exactly the same. It's really just how we deliver the content that makes a difference in timing. You can see here that we were able to reduce the time needed for the program for the accelerated pace by eliminating some of the breaks between semesters and doubling up on some of the classes. So instead of taking just one course at a time as you would in a traditional program, you're actually taking 2 or 3 courses at one time. Again, this is geared for somebody who can spend a lot of time on classes and schoolwork. Our programs offer a great deal of hands-on and real-world experience. We use simulation in our labs with high-fidelity mannequins that can breathe, bleed, and talk to you, which allows you to practice those skills and assessments on mannequins before you have to practice those on real people. Then, as I mentioned, our programs include clinicals in the hospital, where you can care for patients in the emergency room and the trauma units, assist with births and labor and delivery, and attend other specialty clinical rotations. Our students complete clinicals in all of the area hospitals, including University, Cleveland Clinic, Mercy Health, and Metro. Our students also complete pre-hospital clinicals or ride time with many of the local fire departments and EMS agencies. Students respond with their crews in the ambulance to many different emergency calls, including cardiac arrests, car accidents, strokes, heart attacks, and more. You can start to take classes now. You can actually start, if you're in high school, through the College Credit Plus program. And for those that have already graduated from high school, there are grant programs available to assist with the cost of the program. You can take the EMT program in any of the semesters. Once certified as an EMT, you can start working as an EMT and then continue your education by obtaining your paramedic certification. You can pursue a degree as a registered nurse through LCCC's Paramedic to RN Bridge program. Paramedics also often go on to become physician assistants, to be dual certified as firefighters, and much more in the medical field. If you have any questions or are interested in the programs, please contact me. I'd be happy to talk with you. My contact information is listed here, and there's also a link to schedule a meeting in the description below. Thank you for your time. I look forward to talking with you soon.